Hello, viewers. Welcome to KDRTV Live here from Minneapolis, wherever you might be listening. We are so privileged today to get into another part of the discussion that we began last week. But before we go further, we want to make an apology to the general public for the delay. And this, in part, is because one of our very respected members of our community had a misfortune, passed away, and the burial was today. And our crew was there to cover all of that for you. So we make a sincere apology for the delay. But regardless, we're hoping that this discussion will be fruitful and beneficial for the community. So as we said in our flyer out, we're going to have a discussion about mental health, an issue that is really of significant importance, not to the panelists here, but to the community in America and elsewhere around the world. The key point to note here is that we are here to begin a conversation. The panelists here will not necessarily be presenting as experts in an area, but they're going to give us their views and perspectives about what this issue is, hoping that from here we're going to further the conversation. So today again, we are very privileged to have, among others here on set today, very good resourceful members of our community. First, we have Nelly Torori. Is a very active member of the Kenyan community here. She comes into this discussion with a massive background in social work. She has a master's in clinical social work from St. Thomas University. She's also been to St. Catherine University. Nelly has a very good background. She works a lot with the community, particularly with matters pertaining to the church and particularly with young people. For what she does for a living, she worked with the state of Minnesota in a human resource department as a program and policy consultant, more specifically focusing on culturally specific health services, and she'll be talking about that here in a moment. We're also very privileged today to have one of the most respected friends and experts in the community, Dr. Richard Oni, who is also comes to the discussion with a background on behavioral health. He's a consultant, and obviously you're going to hear that as we go through this. Also with us on the discussion today, we have Betsy Mairura, one of the most respected female leaders that we know in the Kenyan community, particularly here in the state of Minnesota. Betsy, by profession, worked in the healthcare industry. But in addition to that, to the community, she also leads the African Minnesota Women Awareness Group, AMWAG, a group that I, quite frankly, have a lot of respect for. So we're going to hopefully hear from her expertise and what they are doing in the community. Also on panel today, we have Jimmy Mireri, a young man, an educationist by profession. He does a lot in social work and is a major contributor to Kenyan diaspora affairs here in the state of Minnesota. He also is going to give us a perspective of what it is to be a young person, and particularly issues pertaining to mental health. Also privileged to have on set today is Dr.Judy Wanyama. Judy is a nurse practitioner. She specializes that and works around the Twin Cities area here in Minnesota. In addition to that, she is also an educator, works in one of two of the leading academic institutions here in the state of Minnesota and Colorado. Judy also joins here, and we're hoping that we're going to have a very productive conversation. So just to point out that this is a very difficult subject. Obviously, there's a lot of literature about mental health, particularly literature in the Western world and otherwise. And I would be the first one before we go into the discussion to say, for a very long time, I never quite honestly believed in the science of mental health, particularly being an African man. But having taken a deep self-reflection, having dug into a lot of literature about this subject, Western literature and other literature, whether it's Southeastern Asian, African, and West European literature, I will say here on record that this is an issue that we need to address, and that's the reason as to why this subject is very heavily documented. So to start us off in this discussion, we're going to start with Nelly. If you could, please, for our viewers, could you very kindly put this in context? What do we mean when we talk about mental health?
A small Can you hear me?
Yes.
Thank you for that introduction. And I just wanted to clarify that I am with behavioral health, not human resource, with the Department of Human Services. So yeah, today we are here to talk about a very common topic within our community, and that is mental health. And just really to dissect it and to see what do we mean when we talk about mental health, because there are times people come with different perspectives when we talk about mental health. And so just to give us a brief definition of what mental health is, and I'm going to use the World Health Organization definition, where mental health is a state of well-being. This is where every individual realizes or they understand what their own potential is, and they can cope with the daily normal stresses of life, and they can work and live productively within their communities. So when we talk about mental health, it really includes our emotional, our psychological, and our social well-being. So it really affects how we think, how we feel, and how we act. So that, in a nutshell, is what mental health is. And everyone really has mental health. We all have mental health just the way we have health overall. So, and with that, that is just what overall mental health is. And I think as we continue our discussion, then we will go deeper to see what does that mean, because people use mental health and mental illness interchangeably, but they really mean something different, because we all have mental health, but not everyone necessarily has a mental illness. So mental illness is when that state of well-being is compromised, where you're not able to fully function to your full potential. And that is where we find that your thinking, which is the cognitive component of mental health, you're not able to really recognize your thoughts or be able to control them. Or when you're emotional, we know with mental health is really about what you think, how you feel, and how you act. So those are the three components of mental health. So when those three components are compromised, whereas your cognitive abilities are compromised, or the way you react after you've had something, which also talks to emotional or our sensory component, and then our action also don't align with how we perceive what situation we are presented to, that is when we can say someone has a mental illness.
Oh, very good. That's very eloquent way to put it, Nelly. Thank you kindly. So, Dr. Judy, if you could please, for the sake of our audience, this is a very interesting subject, particularly when you're talking about the African immigrants here in the United States. What are some of the symptoms of mental illness, so that we really have a good understanding of what is it that Nelly was talking about?
Yes, so I am going to tell you that we use a screening tool, to assess patients, and this is for the Western world. But I have realized that we have to delve further. So my approach, or mental health practitioners' approach to immigrants, is to ask questions about what is their past experience, what's going on now. So for me, I look at a person, I look at a fact, I want to talk to the family member and find out, is there anything else that's happening aside from, the daily life happenings? Have they lost a job? Do they have an income? Is there been any role changes? Are they aggressive? So those are some of the things that I look at. And just as Nelly said, we want to look at mental health as physical too, because some of the patients present with somatic symptoms. So what I mean is, when somebody comes to the clinic, I'm looking at their appearance. I'm looking at, how do they relate? Are they coherent? Are they dressed well? Is this their norm? So very important that I assess all these issues, and also remember that these are people who've also had post-traumatic issues that I don't know about. So I really want to be cognizant of that and, address that. But again, it's really looking at the whole person. And that's why I will have a PHQ-9, which really is a depression assessment, to look at how are they sleeping, what else is going on, is there any substance abuse? So there's a lot of questions, and we rate that according to a scale. So again, we'll get back to that later in the discussion, but there's a lot of aspects to diagnosing depression, PTSD, and anxiety, especially in our population. And it's understanding what is going on before they come to see me. at the clinic. Thank you.
Dr. Oni, this is your area of expertise. I'm sure you've done a lot of work, not just digging into literature, Western or otherwise. It's something that you've done you do in your daily practices. Adding on from what Dr. Judy was talking about a moment ago, what are some of the causes really of mental illness, particularly among us, the African immigrants here in the United States? Unmute.
There are different things we can attribute to causes of mental illness within our African community. For example, like Dr. Judy said, sometimes people come here with some traumatic experience, and when they get to America, those things surfaces. And from there, maybe from home, they already have experience in the refugee camp before they come here, and they've gone through a lot of issues back home. And they think when they come to America, everything will be all right. But when they get here, they also experience more trauma. They experience more racism, discrimination, and some people don't even know how to deal with that. When they come here, they lost all the friendly contacts, the places where they are familiar with. That is not what they see here. Some of them come here, they can't even find the food they like. That is called cultural food bereavement, when they are not able to see the kind and eat the food they like. So some of this separation from home, separation from family, some people come here only as a single family until they can have a sponsor to get here. So when you deal with our people that come here through different categories, students come here, some people come here as a student. When they come here, they experience issues in the classroom. Sometimes they get misdiagnosed because of the nature of the weather in Minneapolis or in the Twin City here or in Minnesota as a general. Some of these people get what they call affective disorder because they don't see the sun, they don't experience the sun sign in the African countries. So many of those losses, some people lost things that they cannot even describe. So it's called losses of declaration. And so some of these things are the things that happen here that we can see that causes more of mental illness. However, they do not see it at that time. They may just be feeling certain way. Like Judy said, some people may just be physically describing what happened, which is symptomatic, which is called physical symptoms. And they describe it in that way, but other professionals may be able to detect. However, you have to be culturally responsible to know those things. So many things that can cause that.
Okay, well, before I bring in Betsy and Jimmy on you, Dr. Oni, if you don't mind, why is it so difficult for we, the African immigrants, especially men, why is it so difficult for us to accept the fact that there is mental illness and that is something we really should be addressing? In your view, what do you think this is problematic?
There's what we call, when people have culture, and culture defines everything that we do. A lot of us bring the same culture here. You can bring people from Kenya, but you cannot take Kenya out of them. And you can do the same thing from people from other countries that come here, but you cannot take it out of them. And so when they come here, the idea of stigma back home that they carry from home, we see people that are, they call them madness. When they describe them as very crazy people. And so the same stigma is why people are not accepting it. More importantly, men feel that they should be strong, they should be able to accept everything that comes, but realizing that mental illness has nothing to do with macho man, or you are strong or you are weak. And so because of that cultural behavior that we bring as men does not allow us to accept that we have some issues to deal with. And so we deny it, and the people around us stigmatize mental illness, and so for that reason, people deny it.
Betsy, I'm going to bring you on here, and I think as you come in, also, like I said in the intro, I want to recognize the good work that the AMWA group has been doing for the community in the last few years. Quite frankly, we very much appreciate, and you as a person, you've been at the forefront of talking about some of these issues that are affecting our community. And Dr. Oni just mentioned a moment ago about the stigma that is associated with mental illness, if you will. From your experience, and you as a person and as a group, as MWAG, what kind of stigma do you see with the people and or clients that you work with?
Thank you very much. From AMWAG, that's African Minnesota Women Awareness Group, we deal with so many people who have come to us for help through the mental health problem that they have encountered. And on this, what we normally see is that, like here, the way Dr. Onia said, men, mostly they are being affected at their homes. About 45% of the men, they are affected mentally, and they don't report it because they feel the ego. They feel they are the provider in their home. So if they say that, that's going to be weak. But mostly, we have also seen that people fear stigma because they see if they gonna say something, they're gonna be labeled that they are mentally ill, and they are not going to seek for any treatment. They are not going to seek for any help or any support. But we come here in and tell them you need to go for counseling, you need to be educated and get to know that you have to accept that you are sick. Once you accept, even if you go for support, it's easier for you to get help. And again, stigma in the community. If you declare that I have mental illness, it seems as if some people start to distance themselves from you, and then people start to isolate themselves. You find that most of the people, they become unsocial, and we leave those ones who are suffering, and that's how they lead to even this mental health to affect them more. So mostly people distance themselves, and then they hide from people, from church, from the community, then from their families. That is a big stigma because they feel that I don't want to be labeled that I have mental health. But we come in and direct them to where the resources are. We direct them where they can get counseling. We direct them where they can seek support, help, accept, and be blessed, so that at least they can accept that they have a problem and they can go for treatment. Thank you.
I'll get to you, Jim, in a moment. We're going to focus on you in a moment, but I want to bring back in Nelly and Judy. Nelly, you've done this. This is what you do for a living. You work for the state. You've done a lot of this work with other communities, not necessarily Kenyans or Africans. And you, Judy, this is what you do on a daily basis as a consultant, and it's what you teach on college campuses. Is what you see in your workplaces unique compared to what we see in the African communities? Nelly?
Sister Nelly, you are muted.
Sorry. Yeah. I was saying that when we talk about stigma, there is mental health stigma overall that actually affects any ethnicity or race. Especially when we talk about the Western world, we do have the stigma even within people from the rural part and the people from the metro part. So that's where with us as immigrants also, our stigma really stems from our roots, our backgrounds. Because many of you can remember our growing up, mental illness was not something that used to be discussed, leave alone talk about it at our dinner tables. So it's not a subject that people talk about openly. So because of how we talk about it, the way we treat the issue around mental illness, that is what exacerbates the reaction that people get whenever someone is diagnosed with a mental illness, and their lack actually of needing to access services because of that stigma. So I would say one thing we know, even through with data that we know, is that for 1 in every 5 adults, they do suffer from mental illness. So that tells us mental health is real. There is mental health. So the fact that there is stigma doesn't mean we are minimizing the effects of mental illness. So that's where we need to go back and talk about how do we need to talk about mental illness by really normalizing it the way we talk about other physical conditions. People talk about having high blood pressure. Someone has diabetes. But because someone, especially I will talk about the mental illness can be divided into two groups. We have others that are mood disorders. That's where we find things like depression, anxiety. But then when we go, some of those other chronic ones, like that are called psychotic disorders, that is where now people have hallucinations, delusions, and all that. That actually even scares people mostly because people are not too familiar with that. Someone talks about things that otherwise would not make sense to someone when you are not having those symptoms. So until we educate ourselves to understand what are those symptoms and how do they present, that is when we can start addressing mental illness and be able to support our loved ones that are suffering from mental illness instead of pathologizing those that are diagnosed with a mental illness, instead be their support. That is when we can really start addressing the mental health stigma within our community.
Judy? Can Judy hear us?
Yeah, I can hear you. Can you hear me? Can you hear me? No? Can you hear me? Anybody? Hello? Hello?
Judy, we can hear you. It's your turn now
You
to
can
speak.
hear me?
Yeah.
Okay, it's my turn. Okay, you can hear me. So, I love, so mental health, I mean, my perspective, and, according to research and how medications affect, the, mental health spectrum is one, we have a lot of neurotransmitters in our brains that affect how we feel, how and when we sleep. So if there's a deficit or if there's an overflow of this neurotransmitters, what happens is then maybe we are overexcited or maybe we can't sleep. So I want us to, I want to take us back to our biology that we learned, there's dopamine, there's GABA, there's norepinephrine, your fight and flight. What makes you sleep and, be able to digest everything? And what if you have a deficit of that? It's just as if you take coffee. When I take coffee, I am up and awake, even when I didn't really sleep much. When I take maybe a calming tea, I would, feel like I'm in a sleep. If I take Benadryl, for example, I feel like, oh, I'm just a little drowsy. And there are chemicals involved in that. But what we forget is, as Africans, our bodies work the same way as everybody else, and sometimes we overstretch ourselves, and we have to understand that mental health is based on these neurotransmitters. So again, if you're stressed, you're going to have some anxiety. If you are, overthinking, not sleeping, there are other stresses in life, and you're just not functioning at where you should be. Sometimes people have depression. Just as we spoke with our, Dr. Wani, Nelly, and Miss Betsy, sometimes, you come here and you're not prepared because it's not the same thing. So you're trying to adapt to a different culture. So again, how does stress affect your body? And I really want us to understand that, anybody who's stressed, first of all, blood pressure is going to be high, blood sugars are going to be high. So again, you're here as everybody else is right here. So as you are relearning everything, you're trying to here as young, Africans coming here, we try to emulate, say, not Miniman, but 50 Cent. you're trying to twang and speak like everybody else here, trying to make sure your culture resonates with everybody here, you have to be aware that that is also a stressor. So very important that we understand that all these things can cause inflammation, and that's why, we are stressed, but sometimes we don't know we are stressed. How are we dealing with the stress? We think that we are immune, that, I am an African, I am not stressed. But you know what? Not true. Not true. Because really, when we look at the inflammatory factors, they affect us. And that's why we have so much blood pressure, like diabetes going on. But, we don't want to go in and get checked because we think it will not affect us, but it really does. So I want us to factor into all these other factors and the fact that, we're human, we're dealing with this, and stress can present in so many other ways. And, for men, I am strong, I am an African man, and it's okay. But you also have to be aware of what your body is telling you. Yeah, it's my take.
Good, thank you. Thank you. So here's another take. We're looking at it from a more parental perspective. Where the parents work hard. I mean, obviously, you're going to expect the stress from within the home, and you're going to expect these external pressures that might come about as a result of what we do for a living in our workplaces and the interactions that we have beyond home. But there is a segment of our population that we really also need to pay attention to, and that is the young people. Dr. Oni, you do this as well, and I want to bring in right after you, Betsy. Do the young people experience the same issues that we are talking about, or are we as parents not paying very close attention to what the young people are doing? And potentially that could be problematic for the immigrant population if we don't address this. Dr. Oni and then Betsy.
Thank you very much. When it comes to youth and mental health, parents need to be very sensitive to everyday behavior of a kid or even a young adult. Those behavior can range from sometimes maybe the kid that is very outgoing just of a sudden start isolating himself or herself. And the parent may not be paying attention, just thinking it's something that will come and go. And a lot of times that is what usually let things get out of control. So it is important for kids to also know that, for parents to know that kids also experience some of those diagnoses that we talk about in terms of depression, anxiety. The kids really are in trouble because they live in two worlds. They live in two worlds, and those two worlds, I consider them as kids that I call ABC, American born confused. They are so confused in their new environment. And a lot of times, parents don't take advantage of that. They look at them and say, why will you be stressed out? I'm the one that goes to work. You're just to go to school. Well, they don't know what is going through in school. Sometimes in school, the kids cannot adjust well with their teachers. Maybe they are the kids that have accent, and the kid will be, kids are very bully. They will start bullying those little kids or young kids that have different outlook, different physical outlook. And so kids go through a lot of trauma. And the kids, when they come home, they don't express themselves. They don't have enough language to describe what they are going through. So it is the parent that need to watch those things. Maybe the kids who doesn't even take time to sleep at home, now they are sleeping too much and spend more time at home. Some friend will come and visit, they will say, I don't want to be out today. And this is the kid that like to do those things. So parents need to be one that monitor those kids, and they need to know that the kid will always be kid. They may see other things that other people are doing at school, and they come and copy that at home, and they get confused because the parent will not take a look at that as what need to be happening. Especially African parents, we are very, very strict. And when we come here, we take the same strictness that we went through in the 60s or 70s. And those kids are not the same kids. So we need to really nurture them and look at the way you are brought up, that this is not what they are going through. I have kids that sometimes when they talk to me, I have to zero in because what they are telling you is what they learn from somewhere else. And until you know that, you will start blaming them and thinking that they should know better. But they don't know anything better. In fact, like I said, they are confused. They are born here, they live in two worlds, and they cannot separate that. You as an adult, you can separate those things. You have the same language to express it. Those kids look at you like, Mom, Dad, you don't understand. And you say, what is it that I don't understand? I went through ages like you, but you know you did that in Africa, not here. And so what I notice about that is parents need to be very, very sensitive. You need to nurture your kid. You need to take time to ask questions. Pay attention to when they come back from school. Possibly you can let them give you some time to talk. We are so busy that we don't give them enough time to talk. And so they internalize it and they go to friends who will give them wrong advice. So as parents, as we work hard to become what we call American dream, you need to dream African dream. Because in African dream, we pay attention to our children. In African dream, we fetch firewood and water to send them to school. That is why when they come here, we are so busy. So I'd like to advise parents to notice things that the kids are doing and see how long they do them. Sometimes it may just be 1 week or few days, but parents need to look at them and say, this is not a pattern of my kid. And they start questioning that and maybe talking to other adults to say, hey, this is what I'm experiencing with my 10-year-old. When he comes from school, he doesn't do anymore, he doesn't do any chore. Just before, he used to do all those chores. He used to have 8th grade in classes, but now he's having C and D. Something is going on. So it's more of evaluation, it's more of attention, and it's more of really being sensitive to those kids. Do not dismiss their feeling. Attend to their feeling and make it important to you. Thank you.
Thank you for that very insightful contribution, Dr. Oni. Betsy, again, I want to put Amog on the spot because you guys do a lot of good work. We are making an assumption that parents are always on the same page when it comes to parenting. But reality is, based on what you do, you guys talk a lot about domestic violence, and you receive calls and try to mediate all these things. What do you see from your perspective as Emma? Is this the same experience you see, particularly the young people? And how do you mediate or make sure that the parents are on the same page?
From the young people, they also equally experience mental health problems. And from Amwag, we have tangible evidence and statistics of those people. We have done research on how also the young people are being affected, because emotionally they undergo the same, especially when they have lost their loved ones. Like even today, we saw our children and the young ones who are really affected in the funeral we went. And this one really affects them, not unless they have to go for counseling or they have to be followed. This thing does not go, it affects them too. And then there are young people we have encountered are those ones like they have come out and they have said they have mental problems, but instead of that, people run away from them. If they are girls, we have some evidence. They cannot even, when they have boyfriends, you find that somebody says, hey, how can you move with that one? And yet she has mental problem. And then you find that they isolate themselves. They can't even be able to come out. They really need to be educated on that. We found that even the students who are in school, they also undergo mental problems. 20% of the college students in the past years, they were diagnosed with mental health. And this also, mental illness, this affects them also in their school. Then when they have that, some of them come home, they can't even study, and this affects the family relationship changes in this. And then you find the domestic violence pops in. Maybe the father says, you did this, tells the wife, you did this, like that. This also affects them so much. We find that 8% of the college students, they are affected by mental health. And if this affects their academically, they can't perform well in school. This one comes back to the family and it affects them. So you find that some of these children, they start to withdraw, they start to hide, they sleep so much. In this, you find that the parents seek help. What can we do in this? So that at least our children can also be on the right track. They are being affected mentally, and then we direct them to the right resources. Thank you very much.
for your contribution, Patsy. I'm going to bring in here again Dr. Judy and Nelly. We're going to focus on what we do. Yes, we recognize this is a major issue with the society. We can talk about it morning to evening and wake up and talk about it, but how do we manage this? Here's a scenario. A man is very frustrated for whatever reason, whether he lost his job, he's having family issues, decides to go to the bar and drink all night, or decides I'm going to take the next jet and fly to Africa and have a good time with my friends, right? Or decide, after all, America, we have a lot of corona is really stressing us. There is racism here. The world is not fair to me. I don't need this. Maybe I can do something to arm myself. What do you say we as the African immigrant community, how should we manage mental health from your perspective, Judy, and then Nelly?
Sister Judy, please unmute. Unmute yourself, please, and repeat that.
Okay, I'm sorry. Okay, so here, sorry. So I was saying so when I encounter a man who has admitted that they have, they're struggling in their marriage, or they're struggling with job loss, I am very concerned because one, there is suicide and homicidal tendencies with men. I mean, for men who have depression, so we know their chances that they would take their lives and also take others' lives, because usually they have a plan, and the reason is they don't talk about it. So again, I would say is, do you have a plan? Like what's going on? I want to really dig deep into what's going on, because alcohol is a depressant. So anytime a person takes alcohol, they numb the issue for that time. They feel good, and then the following day they wake up, they still have the same symptoms, and they feel worthless. So I really want to talk to them about getting help. Talking to other fellow men and just figuring out what else can we do at this time. And I love to involve family because one, maybe the wife doesn't understand that this man is really struggling. I have not seen an African man cry, and when I see one crying, or when they even seek healthcare services, then you're thinking we really need to intervene. So that's why I think it's really important for you as a healthcare professional, even as a friend, to ask, do you have a support system? Because a support system is not the wife. A support system is a friend who they can talk to about what they're feeling. And it's not about even the mental abuse. It's them feeling emasculated. They're not men enough because they're drinking. The society doesn't look at them as a provider. So I think we really need to focus on what else is going on and really be understanding. So my biggest take on this is, find out, do they have a support system? Before they even go back home, ask them what does family, mean for them? Is it being here? Is it being back home? Do they have somebody they can talk to? Because you can tweet or talk to them all day long, but if they don't relate to you, they will not really listen. So again, let's go back to the basic. That's why we really need each other. I mean, friendships. And people say women live longer because they have friends. They talk to people. I mean, can you talk to a fellow man without feeling weak? Can you talk about issues that are affecting your marriage without feeling weak? Can you talk about sexual issues without feeling weak? Can you talk about, what else is affecting your marriage? Like, you're not making enough money. Maybe your wife just graduated and now she's making 10 times more than you make. Can you talk about those things? And really it's personality, because not everybody is going to make, that money, but where do you come in? So friendships and true friendships. And really, that's where it all begins. Before we even introduce medications and, what impacts what, that's where we start.
Great point. Earlier, we were talking about stigma that is associated with mental illness. So, going into literature, I realized that quite often women tend to make decisions largely based on emotion, which is a good thing. And then men tend to make decisions largely based on logic. But also, based on what we were saying moments ago, when some other people are going through pain, it turns out to be entertainment for others. Nelly, how do you navigate that?
I think when we talk about mental health, we know that the way mental health symptoms are presented within men and women are different. And you very well articulated that men mostly is the symptoms are presented as being angry, being aggressive, versus women who tend to be more emotional, and sad and things like those. So that's why sometimes, it is difficult to be able to diagnose men, and especially because men don't tend to are not more overt about their feelings, to talk about what they're feeling, what the experiences are. And first of all, I think can all agree to, the first thing is really, who are your network? Because those are the ones who know you better. Those are the ones who understand you better. Because we can only recognize mental health symptoms in someone as good as we know who they truly are when they are functioning in their normal capacity. So that's why it is necessary that we need to get to know who our loved ones are, so that when we start noticing something different, something that's amiss, then we are able to start recognizing that, to know how do we start intervening earlier on before things escalate into a crisis situation. So again, men, of course, we know as African men are the mostly we come from a community where men are the priests of the home. Really, they make decisions and they're the ones who have the final say according to our culture. However, when someone is having a condition like a mental illness, even if you're the man of the house, I think as women, being that is your husband, we first of all have to acknowledge that something is happening and be able to recognize. I think Judy mentioned also who are the support network for that man. Maybe it's friends that we need to connect so that this man can be able to listen, because sometimes men tend not actually to seek services, but because it is necessary that we intervene, we may reach out to their friends. And at the same time, we also need to start, when we talk about mental health education and raising awareness, we want to really focus on the well-being part versus talking about the illness part. So as you talk about the wellness of someone, then that's when I realized that I don't think I feel that way. Then something must not be right with me. Then in that way, then someone is more encouraged or motivated to really want to talk about, you know what, I don't feel this way. I know this is how I'm supposed to feel, but that's not how I feel. So whoever their trusted support is, whether it's maybe their doctor or whoever that is, then they may be able to start talking about those symptoms. So number one really is being able to recognize, being able to acknowledge, and then being very careful to not judge. Many times we start talking more around, we address people by their symptoms. That is why we need to be very careful to address someone by their first name, by the first person versus their condition. Because we hear people say, oh, that, like a schizophrenic, instead of someone with. So we need to be able to isolate the two. This person is having a condition. They are not the condition. So some of those are the reasons why people feel that they are the problem and they hide it and then they don't speak up. So that is, again, it goes back to stigma. Let's talk about it. Let's show love to that person. Let's show that we care for them and we really care for their well-being so that we can support. And again, you may even want to go actually as a family, whether it's psychotherapy, just talk about what you're going through, so really it's about having your system there to support you through that period versus, again, not condemning someone.
Okay, good. Thank you, Nelly. I'm going to bring in Dr. Oni. Dr. Oni, can you hear us? I want to have Dr. Oni.
I want to add something to that first.
Yes, well, you add on to that, and then you can continue the conversation with are there resources available for African immigrants? And particularly, I wanted you to address directly to men. What resources do you know that are available for men? Go ahead.
Okay, I'd like to add something to the two speakers that talk about men not seeking treatment. And sometimes, yes, they deny the facts, but sometimes they are also concerned about the community gossip syndrome, whereby they believe that people will gossip about this, which is a little bit different from just stigma. It's just a part of us gossip. And so they look at this community gossip syndrome as an opportunity for them to just deny because they don't want the community to know about this. The moment one person knows, it goes around. Now, when it comes to treatment for men, when it comes to cultural treatment for men from Africa, we don't have many of those. Americans try to do treatment, but the way they do it is one heart fit all. A lot of time, people don't ask questions. If this happened in your country, how will you have dealt with this? Sometimes we just jump to the conclusion of how Western world do treatment. We need to ask people questions. If this happened in Kenya, if you are feeling this way in Kenya, what would you have done? So that way people can now get opportunity to be in charge of their own treatment. Now we have places that, like NAMI, which is National Association of Mental Illness, they have some training, they have some conversation with men, for men as well as for women. We have program for men that are feeling untrusted or not being concerned about, which are African American programs. So we don't really have African program that target women, men. We have more program for women than men. So the resources for them is very minimum. I was gathering some information about men and when they talk about their mental health issues, and I found out they do that. There was a research done in the barber shop. When men go to barber shop, just like women when they go and do their fingernail, and they talk about different things in their life. So men, when you go to barber shop, that's when they throw things in the air. They talk about things that happen. And if you are a therapist that time, you start gathering information about how men really describe it because they don't feel vulnerable when they are with other men in a different environment. We are still working, like Nelly and I will talk about how we need to have a program for men or even for women, but more for men. We don't have that. We don't have a safe place where men can go and describe and talk about mental illness. So I will not be able to tell you more about that, but I can just tell you that we are working on those type of things. Thank you.
And by the way, for the audience, Dr. Oni is available to do consultation if that be. So I'm going to bring in Betsy, and so happy to have back Jimmy. Jimmy, hold a minute. I know we're going to put you on the spot in a moment. I'm going to build on what Dr. Oni was talking a moment ago about syndromes. And research is showing that one of the major problems that we are facing, particularly the immigrant community, is what is called the parental alienation syndrome, or the malicious mother syndrome. Is a syndrome in which one parent wants to show the kid that he or she loves the kids better than the other parent, and by so doing, alienates one parent from the children, and by extension, that puts children in trouble. Betsy, I know you've dealt with this issue in the community. How do you handle that? Do we have Betsy? If not, if as we get her back on, Judy.
So, here, one thing I am going to share with parents, or the fact that, sometimes I think as mothers, when we come here, or, as women, you feel like, you still have to, take care of your, the kids, wash them in the morning, cook for them, and then send them off to school. But the role in Africa for fathers was to provide. So when women are providing, or they're also in the workforce, sometimes it puts a strain. And that's why we all need to come to an understanding. Sometimes when I've done counseling for couples, I always say, don't forget where we came from. And sometimes it's okay to just say, I am really struggling. Please help me, for women. Say I worked a 12-hour shift, I'm really struggling, help me. Or even when parents are struggling, they have had a divorce, the kids did not ask to be born in, to this world. So one thing I always want to tell parents is, make sure, do not talk about the other parent in bad faith, or, like share the negative about the other parent, because truly they are the role model of that child. So I always say, talk about them and just allow those children to connect with the other parent, because we know that for young boys who don't have the fathers as role models, I mean, they struggle. They wonder, what happened to my father? And sometimes it's because of the animosity between the parents that they're not able to see the other parent. And then even for young girls, because we know that young girls really want the protection. And if they don't get that, we know a lot of mental health issues arise from the fact that they didn't get the protection. So when they marry, they want to get a man who's like their father or a father figure. So how can we help this girl so that they're able to fit into the culture and also just grow in a healthy man, just like any other. So I urge our African parents, sometimes people don't agree. And sometimes, people fall apart. So it's okay to just work something out. Remember, the kids don't have to be in the, we don't have to involve our feelings or, try to influence the kids when making decisions. We have to allow them to connect. It's so important for these kids. So important.
Jimmy, I want to bring you an apologies for the technical hiccups that we've had with you. We were talking moments ago. Can you, Jimmy? Can you hear me? We can't hear you, Jimmy.
Can you hear me?
Oh, good. So, Jimmy, we were talking moments ago about mental health issues, and we wanted to get your perspective from the young people perspective. Do they experience the same problems? And to put you in context to what we're talking right here, we're talking about parental alienation syndrome. And I know your parents are wonderful, wonderful parents. Very proud of them, and I'm sure the community is very proud of them. They've raised a very nice son and your brother. What is your view of a situation where you have parents divorcing or whatever reason, and the children are put in the middle of that? Your take.
Sure. I think a lot of times when we look at mental health, people assume that it's only a targeted people, right? And I think mental health is a big umbrella. I think many people, if not all people, suffer from some kind of mental health issue, right? And I think when we think about anxiety, we think about depression, we think about PTSD. People go through things on a daily, weekly, yearly basis. And that's a conversation that needs to be had, right? And oftentimes, I think I heard you guys talk about stigmas, and I wasn't here for the earlier conversations, but there's many stigmas to mental health, especially when we're talking about the African community, the Kenyan community, whatever you want to speak on. And I think we got to come to the point where we can have conversations about mental health. We can have conversations about how people feel, right? We can have conversations about where we've been and where we're going to go. So I think those stigmas we can get rid of those stigmas by being vulnerable. So I would say from a young person's perspective, there's definitely a conversation to be had.
Still, back to you again, Jimmy. Thank you very much for that. And by the way, you're very eloquent. I appreciate that. What do you think parents are missing, particularly when you're dealing with younger people? I think there's that divide between the Africans, as Dr. Oni was saying earlier on in his introduction. The parents come here, they have that African mindset, and that's how they view the world. This is exactly how I need my children to be. But again, we also understand as the young people come here, they do adapt to the large American system, which could also be very problematic. And we recognize the fact that especially the younger men are always in trouble. And then the strain that you guys go through school, whether it's racism or otherwise. What do you think African immigrant parents are missing, and what would you tell them to understand going forward?
I think when it comes to an immigrant, which I am, right, first generation in this country, I think there's a lot of expectations, right? I think one expectation is to stay true to your roots, right? Another expectation is to learn about African American culture, right? And another expectation is to learn white culture, right? And I think there's so many expectations for us as African immigrants that sometimes that can go on deaf ears. So I think sometimes when it comes to parents, listen to your children, right? Listen to their struggles. Listen to the things that they have to learn as a young immigrant man or woman. Be willing to have conversations, right? And don't just shoot things off, right? I think a lot of it is learned behavior, right? So if our parents didn't talk about mental health, they're less likely to talk about mental health with us, right? But I think in this day and age, it's a conversation that needs to be had. We are experiencing a lot of things as immigrant children. We have to take on a lot of things in terms of education, new friends, new cultures, and that can bring a lot of issues, and that needs to be talked about.
As a segment, I would suggest to you, I think the next segment probably focus more on younger people. We need to have that perspective and also try to bring those in education sector so that we can have a more in-depth discussion around that subject, because we don't want to miss out, particularly with the younger people. Sorry, Petty, we had a technical problem there. We were talking about resources available for people going through these challenges. From your end, as MWA Group, what resources are available for our people?
Now, thank you very much. Are you hearing me now? Yeah, from AMWAG, what we normally, when we have people who come for resources for help, we always tell them to get seek support, which we direct them to our counselors, where people can give counseling. And then we have also, some of them come, they don't even have food they can eat. AMWAG has done a good job in the community by delivering food to them, especially this time of COVID-19, and people really appreciate that. And we have also, some of them, those ones who need medical help, they are also direct to the right medical. Dr. Oni is one of our doctor we refer people to, and they really get good help. And then those ones also in the community, like children, and they need some education. The parents who need some also, they need support. They are also directed to where they can get support. We have agents like the federal agents also helps them. Then we refer some of them to like the National Alliance for Mental Health. Those ones also help them. And then the Department of Veteran also is a good support for us, whereby we refer some of our people to, like the shelters. They can go, but the shelters are really full. That's why we say we wish we had for our African, whereby they can get African food, African culture, everything that they need. So we try as much as possible with the state is also helping them at least to get the resources they need and the counseling they need. Thank you.
Oh, great. I think that's good. Now that our audience is very happy, we already have a major resource in the name of Dr. Oni. Nelly, you work for the state. Obviously, you're not going to disclose patent information, but are there resources at the state level that our people would benefit from? Okay, unmute, please. Unmute.
I'm unmuted.
Okay, go ahead.
Can you hear me? Okay.
Yes.
Yeah, we do have resources for all generations because really as a state, we're supposed to be there to provide services for every Minnesotan that needs access to services. But I think this goes back to really what Jimmy alluded earlier, is the issue, especially with the young folks, the lack of resources or resources that really meet their needs. And some of those, again, starts from, do we understand our youth? And I think I like the way Jimmy put it. It's about time we do a culture change. As parents, when we are engaging our children, do we listen to them? Or do we come with a cultural background where we know we are the parents, what we say is what everyone does? Or are we imposing the you're here to be seen, not to be heard? I think really we need to, for us to engage our children or our young folks, we need to start repairing relationships so that we can build their trust. Because many of our young folks tend to trust their peers more than even their parents, which is really unfortunate. And especially as immigrant families, where we know that many times the way the system is set up, the services really don't speak to our cultural needs, and we need to be the support for our children, then there's that disconnect. So until we fix our relationship dysfunctional, how our dysfunctioning from homes, where we need to start repairing our relationship with our children, we need to be able to trust our children, to be able to allow them to direct sometimes on how they want us to support them. Because what they experience, as we talked about earlier, out in the community is totally different from what I experienced growing up. So they are dealing with bicultural issues that may be totally different from me when I speak as an African immigrant. So until we start really changing our conversations from our homes, then we will continue seeing the gaps between our connectivity with our young ones. Another thing I like, we do have resources, of course, for our young folks. There's one program that I like. It's a research that was done. It was done way earlier in the 90s. It's called the Roger Hart's Ladder of Young People's Participation. I like that because it really shows the different levels of how are we involved in our youth activities, and or are we? So it actually has eight levels of participation, and you'll find there are times that from the lowest level where our youth are there, but we manipulate them. So meaning they are there, but we tell them what they need to do. To the highest one, which talks about the young people and adults, they share decision making, meaning we sit at the table, they let us know what they want, then we support them. That is the community we need to support so that our young folks can thrive, because what they go through may not be the same as what we go through. So until we listen to them, we will just continue being manipulative. If you don't, and sometimes even we have some parents actually who even deny privileges to the kids because they have not listened to them. Whereas if we could really take time to listen to them, you find that it's all about their well-being. So I think we need to look into some of those factors of how are we engaging our youth. And we have many ways also that our youth right now in the world of technology. So there's many ways that our youth also using even media campaigns to talk about things that they want to be involved in, resources that are available. So we have many streams that we can raise awareness on how best to support our youth in their programs and really be there for them so that they can see that we are in partnership with them to support them in their programs and how they would want those services to meet their needs.
You make very good points. As we come to the close here in a moment, I think there is a clear divide here, and I want to bring Jim in here in a moment as well, and Judy, if you don't mind. We are talking about, my daughter always reminds me whenever we have a discussion, she always reminds me, hey, listen, it's a generational issue. It's all about the digital immigrants and the digital natives. So, and I think clearly it's not just immigrants who've moved from a geographical place. So, for example, from Africa to America geographically, but we are talking about the digital natives, and the digital natives are these younger people who've been born at a time and growing at a time that is associated with technology, and you see them very present in the social media, and that's why you're seeing in the streets and around the world making revolutions. But we also have digital immigrants. There are those of us from the old school who don't have access to social media, whether it's Instagram or Facebook and the likes. So the question I have for you, Jimmy, and then Judy, how do I tell if somebody has a mental issue, particularly with their social media postings, whether that is on Facebook, Instagram, TikTok, and those many other social media platforms that I don't know? And then Judy, you can chip in right after Jimmy. Jimmy, go ahead.
That's a good question. I think most, if not all, I want to say millennials, younger people, are probably involved in social media in one way or another. And I think social media plays a big part in how we feel about ourselves, right? A lot of times there's those unrealistic expectations that we see on social media, right? We see celebrities looking a certain way, and then that's an expectation for us, right? And I think that is our kind of realm, right? That is our realm, and that is social media can be used in good ways, but it can also be used. It can also be perceived as negative, right? So again, I think it just goes back to what I said earlier about talking and having conversations, right? A lot of times we think about there's people have physical illnesses and people have mental illnesses. There should be equity between the two, right? If your child has a physical illness, you're going to take that very seriously, right? But when there's a mental illness, we don't always take that seriously, right? But illness is illness, right? Illness is illness, and need is need. So I think it just comes back to the whole trust, conversation, dialogue, to see where your child is coming from, right? And if we can't have that trust and dialogue, we're not going anywhere.
So, my take on, social media. So because of generation and the fact that we don't really take what our young people are saying, and, one thing that I realize is I get stuck in between, and some of, the signs of, somebody who's seeking attention or, trying, maybe going through something is they might post something, but see, are we able to pick up on those clues? And I've seen, people who are depressed or people who are going through some kind of turmoil, even adults will try to post a lot of, pictures or really, post a message. And so we are not able to pick on that. And sadly, I can say that, sometimes when I've followed up on cases where, a teenager or somebody has, committed suicide or, has committed a homicide, I realize that they actually posted something, and the problem or, the issue with us not being able to pick up on that is we ignore those messages. And right now, even with COVID and just the fact that people are so isolated, the only way to communicate is maybe social media or, WhatsApp, like uploads or status, like a status upload update. So my thing is, if somebody is posting, if somebody, says something and you're thinking, that doesn't sound like that person, I think reach out to them, because sometimes we have a tendency to just say, you know what, well, they just copied and pasted that message. But you know what? Is that their norm? Because we are not able to connect with them. We don't know what's going on. They're probably depressed or something is going on with them. So reach out, because truly, I feel like a lot of people, might not tell you upfront what's going on, but they're able to actually write it out or just post something. Just like how you can text a message to somebody and you're not able to tell them on their face, like, oh, this is what I feel. So I think we need to really pay attention to that. And for young people too, I mean, for suicides, for homicides, for even drug abuse. We cannot alienate, because this is the world they live in. This is what they know. This is what they've grown up with in school. So when we say, oh, you know what, I don't get that, because, yeah, in my world, I never heard of methamphetamines. I never heard of drug abuse. And guess what? You know, this is the generation we are growing in. So it's okay. Sit down, hear the conversation. Just like Jimmy said, you know, sometimes I have patients or teenagers coming in and they tell me, oh, you know, this is what's going on in high school. And instead of being shocked and saying, oh my gosh, I rebuke you in Jesus' name, we should be able to say, tell me more about that. Like, how can we actually be part of the conversation as opposed to rebuking and just, you know, reaching out for the Bible? Because that doesn't solve anything. It just alienates this kids more.
Tony, you've been quiet for some time. You know, at any point as we prepare for the last closing statements?
Well, from what I've already been saying, I believe that some of those behavior are nothing but communication. And if a child or youth is communicating, is behaving a certain way, we need to look at it as a form of communication to the parents or even to the provider. And so a lot of time, that is very important to understand. And sometimes, like my professor said, majority of the time we underestimate what kids can do. And so when they say, I'm going to kill myself, well, we have to take it seriously. I know in African community, we might say, go ahead and do that. Well, because we believe they may not do it. So we cannot underestimate. Any behavior need to be taken seriously and need to know that it's a form of communication. And we need to hear it and listen. And that is what I think has been happening with kids, that sometimes they commit suicide because they believe nobody's listening to them or taking them seriously. So please, as we continue these sessions, we need to talk more about our African parents. I know some of them have lost the way they parent back home, and it's so difficult to get that back because they're parenting kids that live in two worlds, and they themselves have to learn to reparent their kids. What you have before doesn't work. So we get to turn and do the narrative, change the narrative. Listen to the kids more. Before back home, you can't talk. So now they can talk. They have freedom. And the same thing with relationship of men and women. You know, back home, many of them don't work. Here, they work harder than even men. Yet, we want to sit down and read newspaper. We can't do that here. And that is one of the issues that I notice even in my practice, that men still believe they're in charge. Guess what? They are not. We are not in charge. We have to work collaboratively. That is what we need to learn. But parenting is very, very difficult in this country. I will not denounce that. I parent two young women, and I know that was tough. So, but I have to relearn things. I am no longer the, you know, even though my kids, when their mother travel and they forget something at school, I will tell them in the morning, I am not a helicopter mom that just pick up things and drop things off. I am a field drill sergeant. But I found out it doesn't work. So now I'm a helicopter mom. I drop things off, I pick things up. So we need to relearn some of those activities. Thank you.
Thank you, Dr. Oni. I learned something today. Helicopter moms and helicopter dads. That's an interesting terminology. No? So again, guys, we're running out of time. Nelly, closing statement in 1 minute.
I think we've talked a very broad effects around mental health, mental illness, and our youth, and how we can start addressing our issues as a community. And I think, as we all know, even when we look at data, there's really very rare or scarce data that speaks to the mental health and its effect to our communities. So most of what we have talked about, or what we get, a lot of the research that we see is really based on different subjects that may not necessarily be a cultural background. So until we really want to be involved to tell our story, someone else is going to tell our story. So it is about time we start having these conversations. I know there is stigma, but for us to get better, we have to get uncomfortable. I like, Jimmy, when you said we have to be vulnerable. When you get vulnerable, that's when you start talking about issues that really speak to your heart. So once we do that, then we will want to be at the tables where decisions are being made, where even those that are in leadership are able to design programs that speak to some of us who come from other continents. So unless we do that, everything that we are talking about will continue to be the same. Where you go in for your appointment, the minute you start, your session, there's a disconnect right there, because it's that cultural, the barrier within your cultural needs. So I always encourage people, we need young people at the table. We need your voices. And parents, African parents, we moved here. We need to be involved in our children's lives. I cannot stress that enough. We need to listen to our children. Mental health, mental illness is real. If we address it earlier, we can really, we can be able to address the symptoms before they get to psychotic features, where now it gets to a level where our children will have to be on medications for quite some time. And many times this is due to untreated mental illness. So let us be part of the change that we want to see. And that change will be, let's design what we want to see as it relates to how do we want our mental health and well-being. How do we want that story about our mental health and well-being reflect? We can only do that when we are part of the discussions. Thank you for the opportunity.
Thank you very kindly, Nelly. Dr. Judy.
My take is, more screening, and I'd say we can't shy away from these issues. We need to be involved. There's so many avenues. There's a lot of resources. For me, as a primary care provider and a psychiatric mental health provider, I always say I welcome everybody and anybody. And if people are not comfortable seeing me, I have a lot of resources, and I can refer people to other providers. And, it's a free service. We're doing consulting all the time. I am glad to share these resources, and we are backed by research. And of course, MDH is really supporting cultural competency, cultural literacy, and really mental health, especially in this wake of, PTSD and what's happening right now, because we can't ignore the histories of this, country, and the fact that our young people are affected by this. So again, you're welcome. We'll share this with the program director, and please, don't be afraid. I mean, mental health should not impact your physical well-being. It should not impact your ability to function, because it can. And we know depression is actually one of the most common reported factors of unemployment, or risk factors of unemployment, or just chronic disability in the United States. So why not address it? And we are not immune to that. So again, we are open, and we have resources.
Thank you. Very well said there, Dr. Judy. So Jimmy, and again, apologies for the technical hiccups, and I'm sure in the next segment, we're going to have you probably moderate. So Jimmy.
My final statement is for young people, but really for everybody. I think it's important for us to work on self-therapy. And self-therapy can be something as simple as doing something that makes you happy, right? Spending time with people that bring the best out of you, right? Eliminating things that bring the worst out of you, right? I was just talking to my friend not too long ago, and he told me that he deleted his social medias, right? Instagram, Facebook. He deleted them, he deactivated them, just to take a break, right? And I think oftentimes we rely too much on other people, right? And sometimes it's okay to take ownership. It's okay to do things that are going to bring the best out of us. So my message is to work on that self-therapy, do things that are going to bring positivity, that are going to bring positive energy. And it's okay to eliminate people in your life that don't bring that. Okay? And that's my final word.
Okay, thank you. Very eloquently said, and very proud of you, Jimmy, and I'm sure the panelists will agree on that note. So, Dr. Oni, you've been very resourceful. I think your contributions have been very insightful, and I'm sure the public is going to appreciate your work here. Your closing statement.
Okay. Well, all I can say is, World Health Organization said there will be no health without mental health. So let's take that as a warning that without mental health, there is no health. Thank you.
That was very succinct. So thank you very kindly, Dr. Oni. So, Petty, I left you to the front end because you're the mother. You speak on behalf of the many mothers and in our community. Your work is obviously very respectable, and personally, I have a tremendous respect for you. Your final statement.
Okay, thank you very much. For me, from African Minnesota Women Awareness, I say speak out against the stigma. And if mental health affects one of us, it affects all of us. And it affects all the community. And then the last word is listen when your spouse sharing about the day, when your spouse comes in, listen to what the person is saying and what he felt that day. Listen when your child is explaining traumatic experience the person had or the child had in school or at work. We better listen for that. Let's communicate. Let's not be ashamed of our mental status. Let's communicate. And by communicating, we're going to get help from somewhere, someplace. What we do in our office, we have resources. Just feel free. It's confidential. Come and get help. And we are ready to support the community. We are ready to listen to you. The only thing we give is listen to you and direct you to the right resources. Thank you very much.
Okay, thank you very much. And I think that will bring us to the end. I want to take a moment to thank the panelists, and I think I apologize for the technical hiccups we had, and I'm so happy that you're able to stick in there to make this contribution. So I want to thank you individually, Nelly. Thank you for sticking in. And I'm going to apologize on your behalf to the group that you're supposed to meet tonight. You are doing this for the community, so apologies for that. But again, thank you very much for your contribution. Judy, thank you. Your very insightful contribution, I'm sure, are going to reflect well to the community, and I hope you, in the future, I think the way you address should be a message to the nurses and those who work in the public health sector, and you really need to pick up from here. I'm a business professor. I'm not very knowledgeable with matters of health. I think going forward, it will be important that we have those of you in the community who work in the healthcare industry to come in and move this conversation forward. Jimmy, again, I can't thank you enough for the good work, very eloquent, and we're hoping that you will come next time when we focus more about the younger people, because I think we have to invest there, because that is the future for our community. And Dr. Oni, once again, thank you very kindly for that. And Betsy, when I address you, I'm addressing the AMWA group. Thank you for the good work you're doing to the community. We appreciate it, and we look forward to working with you as well. So finally, I also want to thank all the listeners and viewers who've taken time to listen to us. Thank you very kindly for your time. We'll just make a point here that all we are doing here is just to start a conversation around some of the topical issues that affect our people. Today, we're talking about mental health, mental illness, and mental wellness. And we're hoping that from here, you're going to provide us feedback. Feel free, please, to send us feedback either individually to the panelists here or directly to KDRTV. We have our outlet on Facebook, Twitter, as well as YouTube. Whichever way you want to get to us, please give us feedback. We'll appreciate that so that we're able to work in a better way going forward. I also want to thank our crew at KDRTV, Bernard Guto Kebuato. Very sincere thanks. Is providing the platform for the community. I think we really need to give him a big hand for the good work he's doing. And part of the reason as to why we were late to come on air, because he was covering the funeral service of our departed friend, Dr. Nyambane. So again, Kebuato and your crew, we appreciate you, and I'm sure the community joined me in thanking you for the good work that you're doing. So I think that is it from us. All I want to say, closing statement, please let's pull together, particularly for experts in different areas, whether you're in the healthcare industry, whether you're in education sector, whether you're in law, whatever you are, whatever you think you are comfortable, please try to reach us so that you can also guide this conversation forward. All we did here today is just to start a conversation as part of our service to the community. We're hoping that you will do that the same. So as I went down again, I want to welcome you to another presentation tomorrow night. We're going to have experts. We're going to discuss a major topic that is of interest to many. We're going to talk about being Black in America, challenges facing African Americans here in the United States. So we'll be assembling a group of experts who are going to take us through what we hope to be a very thought-provoking discussion. But for now and from us here at KDRTV, thank you very kindly for listening. Thank you and good night.